as a physician, one of the things I keep getting asked a lot about is dumping syndrome, once people have had their bariatric surgery. So I thought I'll say a few words about that. On to my next slide, please. Okay, so this is a typical example. So Jane underwent gastric bypass surgery 6 months ago, and she now has a problem of sweating, shakiness, anxiety, feeling faint, getting very hungry 1 to 2 hours after a meal. Um, do you recognize these kind of stories? Have you heard of them?
No.
Okay, so this is basically what we describe as dumping syndrome, and it is not an uncommon experience once people have had bariatric surgery. It can occur with actually any form of bariatric surgery, although the gastric bypass is seen as a typical form of surgery where people experience these kind of symptoms. So there can be a couple of different types of dumping syndrome, and the mechanism of the dumping syndrome differs depending on whether it happens soon after food or a little bit later after food. So these are symptoms which are triggered by food and drink, at meal times. So we'll move on to the next slide, which essentially the reason this happens is, so the figure here, before surgery depicts what a normal stomach would appear like. And essentially it acts as a reservoir. So when you eat food, food goes in there, stays for up to about 4 hours, 3 to 4 hours. And it's turned into mush before it moves on downwards into the small bowel. But once you have bariatric surgery, so be it the gastric bypass or the sleeve, you now don't have that big reservoir holding food and then trickling it down slowly. Instead, whatever you eat at a mealtime will just run straight down into the small bowel without that period of holding. And therefore, it then causes a lot of changes further down, and that can cause these dumping syndromes. So like I said, there are these two types of dumping syndrome. There's one called the early. The early dumping syndrome typically happens about 15 minutes after eating or drinking, and up to about an hour of eating food. Late dumping tends to happen beyond an hour after eating food, and the mechanism of these two forms of dumping syndrome are slightly different. So essentially, in the early dumping, what happens is whatever liquids you have taken then cause a shift of fluid balance, and it then makes you go lightheaded and dizzy, and basically like you're going to faint. So that is what is described as early dumping syndrome. The mechanism of the late dumping syndrome is slightly different in that it is triggered by low blood glucose. So what happens there is essentially the food that you have eaten sets off a surge in insulin levels. But because you're eating relatively small portions now, there's not a lot of carbohydrate going through, but the insulin levels are on the high side, and then they cause your blood glucose levels to plummet. And it basically gives you a hypo. And that then causes the symptoms of a hypo. And that would be the kind of symptoms that Jane was describing there, where you get these feelings of hunger, anxiety, shakiness, sweaty, so on and so forth. And so essentially, it's important to understand that there are two different types of dumping. The mechanisms are slightly different, and that has a bearing on how we best manage it. Now, in terms of somebody is asking there, how long do the dumping symptoms go on for? Again, it depends partly on what has caused it, how bad the trigger was in some ways, and how bad the symptoms were. So if you have very mild symptoms, they may just pass within minutes. So if you take a typical episode of early dumping syndrome, most people find that if they sit themselves down or maybe even lie down for a few minutes, it'll pass. But on the other hand, if you have had a significant trigger, the symptoms may carry on for much longer until you have managed to correct it. So yeah. So somebody else has asked, is it common to get this, or will some not get it at all? Yeah, so there will be always exceptions to the rule, but what we find is, the vast majority of people who undergo gastric bypass or sleeve gastrectomy will experience some degree of dumping syndrome at some point in their bariatric career. Yeah. Because a lot of the things that you do after the surgery is going to be a learning experience, and whilst you're discovering what works and what doesn't, it won't be a surprise if you occasionally experience an episode of dumping syndrome. But that shouldn't necessarily worry you or put you off. That is part of living, isn't it? But once you know what it is, at least you'll be able to better recognize it and hopefully not be too worried about it. And also it will mean you can take corrective measures to stop it happening in future. So let's actually move on to the next slide, and we'll cover a few more points. So like I said, the early dumping tends to happen within the first hour after food, but quite often around 15 minutes or so. And it's because of liquids shifting around inside the small bowel. And the type of symptoms, can include your palpitation, feeling very fatigued, feeling faint, feeling headachy. You may sometimes feel flushed. You'll want to lie yourself down. You may experience bloating of the abdomen. You may get, start feeling sickly. You may get abdominal cramps, rumbling in the stomach. These are the kind of symptoms you often get. But like I said, they often do tend to pass in a matter of 10-15 minutes or so. Let's move on to the next slide. So late dumping, as I said earlier, tends to happen beyond 1 hour after eating food. And this is because of the blood glucose levels fluctuating. Yeah? And typically, this gets triggered by sugar that is consumed during a meal. Now, when we say sugar, we don't just mean table sugar. Sugars are there in all kinds of foods. Essentially, we are talking about carbohydrates. Now, carbohydrates come in different guises. Some carbohydrates are really good for you, but equally there are refined carbohydrates which can cause all these kind of problems. And essentially, when your body senses that you have eaten sugars, the pancreas produces lots of insulin, and there is then an excess of insulin, which then drives the blood sugars down and gives you the hypo. And like I said earlier, it again causes all these symptoms of feeling sweaty, shaky, hungry, poor concentration, reduced alertness, and essentially you feel pretty lousy when you have these symptoms. Okay, somebody has asked, are people that suffer from IBS more likely to experience dumping? I don't think we know the answer to that, in the sense that in terms of the mechanism of these conditions, it's something that everybody can experience, irrespective of whether they have got IBS or not. And essentially, the triggers here are very specific. So when we talk about the management of these symptoms, which is the next slide, yeah, this might kind of answer that question to some extent. So essentially, it's all about the dietary habits after bariatric surgery. So that's the main thing. That's the key message, about managing dumping syndromes. Well, the most important thing is to prevent them. As they say, prevention is cure. So the advice would be to eat small but frequent meals, and to avoid the early dumping syndrome, we advise that liquids should be avoided for uh, ideally 30 minutes either side of main meal, at least 10 minutes beforehand and 30 minutes after. But throughout the day, make sure you keep yourself well hydrated. Yeah, drink fluids regularly, and generally aim to increase the fiber intake and complex carbohydrates. Make sure that you are getting enough protein in your diet. So the advice would be to aim for at least 60 grams of protein a day. And the other principles that the dietitians and Jody advise you on regarding, stopping eating when you feel full, and the rule of 20s and so on and so forth. With regards to the second type of dumping, particularly because that can be problematic, the kind of things to bear in mind are to avoid simple sugars. So that would be things like corn syrup, uh, glucose, fructose, of course, table sugar, and some things, you may need to look at the ingredients carefully to see what they have, including honey and so on and so forth. Now, this business about sugar alcohols is an interesting one. I had a patient a number of years ago who had gastric bypass surgery, was doing brilliantly, had lost weight, and was feeling £1,000,000. But he was troubled by recurrent episodes of dumping, and he was doing absolutely everything right. So we just couldn't figure out what was going on. The one little indulgence he had was wine gums, and the sugar alcohols in that, in the ingredients, was what was triggering his symptoms. So it just goes to show that it's important to look at ingredients. Some of these sugars, go by these kind of names: sorbitol, maltitol, xylitol, so on and so forth. And it may not always be obvious that these are actually sugars, and they can also trigger symptoms. So it's worth bearing in mind. Somebody has asked the question, will we need medication to control these symptoms? So like I said, I would be surprised if, of all of you for listening to this, once you have your bariatric surgery, if you have never experienced bariatric surgery thereafter. I would expect every one of you to experience, dumping syndrome at some point or the other. So that in itself wouldn't be a cause for concern. Very rarely, some people may have intractable symptoms, and that again comes down to diet and so on and so forth. So it would be really important to stick by all these general principles that we have discussed here. And despite doing the best, if patients are still struggling, we can consider medications. The problem with medications is they themselves come with a lot of side effects. So one of the common medications that is used for this type of a problem is something called, if you get late dumping syndrome, for example, is something called acarbose. Now, acarbose is a medication that was originally used for people with diabetes, but we don't actually use it much these days at all. The reason being, it commonly causes a lot of side effects such as abdominal bloating, discomfort, flatulence, nausea and so on and so forth. So there are other medications, and again, you face the problem of side effects from the medications. So it comes back to that question of, um, you know, um, would you want the side effects of the medications, or rather try and manage the symptoms through diet as far as possible? But yes, so if people are really struggling, then you can always consider medications. So somebody's asked, do you experience any problems with bowel control? Not per se. The dumping syndrome itself shouldn't cause you to lose bowel control. It can obviously make you want to run to the toilet sometimes. But in terms of bowel control itself, that shouldn't be so much of an issue. And the next question is, can you get dumping syndrome if you already take medications? Well, if people have diabetes and are taking medications, that can sometimes increase the risk of having hypos. So, but potentially that could be an issue. But by and large, for people who are on medications for type 2 diabetes, a lot of these medications get reduced or stopped after the bariatric surgery. So, that's one of the great things about bariatric surgery. It often cures type 2 diabetes. So, it may not be so much of a concern. Medications for pain from arthritis. So that's a completely separate question to this issue, in the sense that we generally advise avoiding non-steroidal anti-inflammatory drugs, such as ibuprofen, diclofenac, so on and so forth. But that's to avoid the risk of forming stomach ulcers, and joint ulcers, those kind of things. But taking things like paracetamol or cocodamol, so on and so forth, shouldn't be a problem. Certain medications, especially liquid medications, syrups, and so on and so forth, you may need to check the ingredients or check with your doctor or with your pharmacist to make sure that they are not sugar syrups. So basically, you can ask for sugar-free liquids. So a typical example would be iron syrup, where quite often there's sugar in the syrup, but there are sugar-free options for all of these medications. And likewise for any other medications, be it epilepsy or whatever else. It's not the medications that cause the dumping syndrome, it's the food you eat.